treat that phone call that when someone calls an insurance company as anxiety reduction. Someone is not calling a health insurance company because they are excited or trying to order something. They're calling that insurance company because they're either really upset about something or they're very confused about something. And so that whole notion of call times and trying to get to issue resolution in 5 minutes really needs to be thrown out the window. It has to be really focused on a true consumer experience as to, okay, that's great that we answered the question that they're concerned about, but why do they have this anxiety? Do they understand their plan design? And when you think about open access, one of the interesting things about Medicare Advantage is when someone goes out of network, the fee schedule that the health insurance plan is paying is the same as the Medicare rate. So you don't have the out-of-network dynamic in the commercial space. Yet you see all these Medicare Advantage plans trying to create these narrow networks, which all it does is create confusion and restricts access. And you see what United did probably about 2 or 3 years ago, which is they looked at their entire network of physicians across the country and they said, who are the physicians who are the worst at capturing risk scores, who have the worst star ratings, and let's just get rid of them. And they got rid of all those doctors out of the network with the hope that those patients would end up going to physicians who are in network, and it just creates chaos, fundamentally. There is no notion of how do we actually introduce technology to these physicians? How do we help physicians do their job better as the payer? So, fundamentally, payers have to become accountable for information, have to be accountable for the experience. And there's a lot of opportunities if you take, kind of the scripture around Geisinger in terms of what them and other health systems are doing about trying to make that patient experience better and improving outcomes. There's a lot of areas of collaboration and cooperation available now, but there's a lot of resistance. Some of it, I think, fundamentally in terms of the executive DNA at a lot of insurance companies, and also just a resistance on thinking about new ways of approaching the consumer.
So I'm going to jump now from really the delivery of healthcare, and there was a statistic I found that, and I'm sure it's outdated by now, that there's $35 billion spent on healthcare IT in just the United States. And yet I think what all of us are experiencing is, I hear all week, and our clients, we have more data than we know what to do with, but we can't make it actionable. We don't have the people that know how to actually turn it into something. We don't have the people who actually implement the change that the data, would allow. And I'll add to that because I want to move this into a little bit of a technology discussion. And the one thing we did have a question come up. So as you're speaking to the data, your data solutions, there was a question about the governance, so maybe you could address some of the compliance and governance on this. But the other thing I found really interesting, and I think I'll start with you, Tom, on this one, is Harvard professor Clay Christensen was very interesting. He talked about disruptive information and disruptive innovation. And he, about a decade ago, actually spoke about the healthcare industry. And he said, we're responding the same way that historically disruptive industries responded to what is happening here. We're tightening controls on our existing business models. We're merging, we're closing facilities, laying off workers, forming buying groups, and more, while going about our work in a fundamentally unchanged way. And what's interesting is, and I think, Tom, you all have a very unique program on this, is that there's this argument to be made that innovation has to have this really special blend, especially in healthcare, of the entrepreneurial spirit and thirst for innovation, combined with an acute, deep knowledge of the subject matter and the environment, right? So I think you all have done a really interesting program to innovate.
Right. I think one of the things that we have is we have physician expertise and clinical expertise that you just can't find in other places. And there's a real desire from a lot of startup companies to actually have a chance to work with our doctors and work with the data, the sort of live data, to try to develop their models. At the same point, our physicians would like to do some creative things. We've got great ideas about new apps and other things that can really help their patients. And trying to put those together in a safe environment at SC is what we've done. And one of the things that come out of this, we have the Center for Body of Computing run by a cardiologist, Dr. Leslie Saxon. And Leslie leveraged the film school, the Institute of Creative Technologies, which folks here, it's like the avatars in James Cameron's movie, that's where they came out of it, is that Institute at USC. Combined with 8 different companies in LA, they're all about different expertise, all working on this one idea of creating a virtual care clinic where our doctors could, using avatars, could interact with patients at their home, at work. She did a demonstration as part of a conference where she actually was interacting in the Middle East and sort of creating locally in the Middle East this interaction with the patient. For me, it's a system. We are a high-end surgical hospital. We don't have a lot of primary care.